Everybody, this is a recording of the summary for the session that was conducted with joint venture between KLAY Preschools and Daycare and Apollo Cradle and Children's Hospital. Myself, Meghna Yadav, I'm a consultant child psychologist, and Dr. Deepak Vasudev. He's working as consultant neonatologist and pediatrician at Apollo Cradle. Both of us will walk through a quick summary of the session conducted with the parents about coping with the stress and the realities behind COVID-19. During the session, we are going to talk about coronavirus, what it is, basically symptoms related to it, whether there is a treatment or vaccine, and some do's and don'ts that doctor will help us to understand. I will talk on emotional health, role of parents, about taking care of children, specifically in crisis. Over to you, doctor.
Good morning, everybody. Thank you, Akshay and Meghna. So the coronavirus, a lot has been said, and most of us are aware of what it is. This is a common virus which causes cold and throat infections. It's estimated that 1/3 of us are exposed to coronavirus during our lifetime. There are several subtypes, but however, the latest one, COVID, the novel coronavirus, this has been thought to have mutated from mammals and um, um, transmitted to humans. So there are two other subtypes which caused serious illnesses, something like Middle East respiratory syndrome and severe acute respiratory syndrome. This was also caused by a different subtype of coronavirus, and that killed thousands of people. The current COVID-19, we came to know about this in December 2019 in Wuhan, in a wet market, and then it was a cluster of cases of pneumonia and deaths. But now it has spread all over the world, and as we know currently, more than 100,000, 1 lakh people have died due to this disease, and those who have infected, that is from the test, is more than 10 million. The figure is increasing. The thing is, it is like a severe flu, and it causes mortality in roughly around 2 to 5%. So the red flags, if you're over the age of 60 years, and if you have a blood pressure problem, or if you have diabetes, or if you're taking any medicines for cancer, it seems to affect severely. So roughly 1 in 5 adults will require treatment in the hospital. But the good news is majority of patients affected will have minor symptoms. Coming to the children and the younger people, overall it seems to affect the children and young people less. So in the studies quoted, around 2% of population under the age of 20 years seems to have been affected with disease. But however, this is a caution. It can affect any age. So even a newborn baby and fit and healthy adult can also have this disease, and some of them unfortunately will die. The symptoms are similar to flu: fever, cough, and shortness breath. The main things one should be worried: if you have a high fever, cough, and if you're not able to breathe properly, shortness of breath, then you should contact the emergency or 104 if you are in Karnataka. And especially if you are in contact with COVID-19 patient, or if you have traveled recently from abroad. The incubation period is generally around 2 to 14 days. Majority would get sick by 5 days. The main mode of transmission would be from direct contact, person-to-person contact. Suppose if you are near a person who is coughing and sneezing within 1 meter, then you would get the infection by droplet, and also something called fomite, the infected surface. So if you are touching anything which has been the surface contaminated by the droplet infection, something like table, lift, buttons, those things, then one can get infected. So the how to prevent the spread is mainly stay at home and maintain a social distance and wash hands frequently. So with soap and water, and if you have a sanitizer, also use alcohol-based sanitizer, and the alcohol concentration should be more than 60%. The main important thing is don't touch your face, the nose, eyes, and mouth. The treatment is largely supportive. As I said, 1 in 5 to 1 in 6 people would require hospital admission, and 1 in 20 will need a critical care or ICU bed. So around 5% of population infected with COVID will require ventilator support. And unfortunately, 30 to 40% of them who need ventilator support will die. The vaccine trials are underway. It will take probably a year or 1.5 years to get the vaccines. So the do's, what we should do, know the facts. Don't rely too much information on the WhatsApp or social media. Don't panic. And if you have symptoms of cough, fever, and difficulty in breathing, and you should contact the medical person. And other main thing is maintain the social distance, stay at home, and proper hand washing and protecting yourself. And I'll pass on the message, the mic to Meghna, because she will tell you about how to cope with the stress and what to do during this period, lockdown period.
Thank you, doctor. So we have talked in depth about symptoms and mode of transmission, and thanks to the rich knowledge that doctor just shared with us. But that's one side of the coin, parents. We really would request you to focus on the other side of the coin, which is actually taking care of children. It's not only about physical or physiological aspect of human functioning. We need to take care in terms of emotional functioning of children at this juncture. And here, our role as parents become very critical because our children are following a routine which is not usual. It is unprecedented time. We have never seen this before, even in our own lives. And given the fact that we have to work from home, managing children with not much help around, it takes it all on our own emotional health as well. But we are the significant adults in the lives of children, and it is high time that we provide the right kind of information to our children. So the very first thing that we need to know, certain differences that as parents should help us in taking care of our children. I would like to share with you. The very first thing is the very thin line between age appropriate information and over information to children. We really need to be cautious enough in talking. Please understand that we cannot keep our children in dark. They do see and hear many aspects related to COVID-19 around us. And if they come to us for any particular question, it is a great idea to answer their question in age appropriate information. Just to give you an example, you can probably talk about the sickness, how it spreads, the basic mode of transmission, and how to prevent spread. The very facts that doctor just shared with us. But you probably need not to talk about number of deaths, how is it killing people, why people are going on ventilator. So this is something that you need to keep in mind when you talk to your children, because again, a very important thing to differentiate is giving precautions to children and developing fear in them. So I'll tell you one simple example about it. If a child is coming to you and asking that, why can't I go out and play? Instead of saying that, hey, if you go out, you will catch the virus and you will get sick. Probably you can say that, hey, to beat the virus, you need to stay indoors. And that is where you are developing the soldiers in your children. They feel like they are fighting a battle. And this will keep the positivity high in children, because feeling of helplessness is something that will put them down. And since the lockdown is extended, it is more important to make our children feel empowered rather than giving them the feeling of helplessness. Keep in mind, parents, about how you say these things to children rather than what you say also, because your body language, the non-verbal cues that you are following is something very well observed by children. And this is something of great importance when we are talking to children. How do you help your children? One wonderful concept coming from research, and this is where I myself got benefited heavily as a parent, that kindly not confuse social distancing with social isolation. Social distancing means you have to keep yourself indoors, stay away from social gatherings, but that does not mean that you have to stay disconnected with extended family members and friends. So having a video call with your friends' children, they are really helpful in having these conversations among their peers. So have children talk to their peers, have video calls of children and their friends. This will help big time. Stay socially connected. You really need not to get into a mode of social isolation, because that will be a killer to our children. And children feel highly connected when they talk to their friends, even through video calls. To summarize the conversation we had so far.
Meghna, your voice is breaking for the last 30 seconds or 1 minute. I don't know about others, but your voice is definitely breaking.
Oh, I hope it is better now.
Yeah, it is better now.
Okay, the 3 R's that we need to keep into account when we are talking to children or following these tips. The very first R is reassuring our children. Please make them understand that you are very much there, and whatever you can do to keep the family safe and healthy, all of you are contributing to it. So reassurance of your availability to children, both physiologically and emotionally, will help immensely. One big challenge that we all are facing is that we are not following the routine that we are used to. And the solution of that problem is very much rooted in the problem itself. So the problem of routine can only be solved by having another routine where we are providing a strict structure to children. So have some time zones, at least in your family, where it is breakfast time, lunch time, dinner time, and please don't deviate much from that. Also having a routine where children have some activity time, screen time, family board game time or family time, exercise time. These are the aspects that you really need to keep into account, because giving a structure or giving a routine to children will provide them predictability of the day, and that will help a lot into giving them the feeling of empowerment. The last thing and very important thing, the third R, regulation. So parents dear, kindly regulate your own emotions so that you can help your children very much. As I said, children are watching you, observing you, your own stress level unknowingly you will pass on to your children. So regulate your own emotions to regulate your children's emotion. Thank you so much, everybody, for listening to us. If you have any questions and you could not attend the session, you can write to us at parent.support@clayschools.com. We are more than happy to assist you with your questions. And please stay tuned. Every single month, we bring a webinar at your desktop and share the relevant topics related to parenting. Thank you so much. Stay safe, stay healthy, parents.